Today I'm going to talk about traumatic brain injury and how imaging can help. Traumatic brain injury, or TBI, there's two broad categories. There's closed head injury, and then there's open or penetrating head injury. Most of what we see is going to be closed head injury. This is blunt trauma. These are things like fall, assault, motor vehicle accidents. Same thing with like low velocity, repetitive trauma that we see. Any of the sports players that are having low impact repetitive is going to be that blunt closed head injury. The more severe your TBI is, the worse you do long term. The less severe, the better you do. Makes a lot of sense. Closed head injury, more common in young men. It's more common to have an MVA as your cause of severe traumatic brain injury. Always think CT in the acute setting, so emergency room, CT. Unless you happen to have an MRI, then you could do an MRI. But MRI is going to be far more sensitive to abnormalities. Conventional imaging is usually normal for mild traumatic brain injury. Maybe you see some hemorrhage, but it's usually completely normal. And then with our advanced techniques like FA values on DTI, you can actually look at the microstructure of part of the brain to decide whether or not there's any integrity loss.